I think if you're looking to incorporate either IPL or lasers or any other sort of energy device into your practice, what you really need to do is look at who the patients are that you're treating, what their skin types are and what sort of conditions they're coming to you with. So for example, if you work in an area where you've got a lot of fair-skinned patients with a lot of sun damage concerns, IPL is a great treatment for that demographic. But if you have patients with a darker sort of skin type and more pigment concerns, you might want to look at a laser that's good for pigmentation and is suitable for darker skin types. So I think what you need to do is ask yourself, well, who's my ideal patient, or what sort of patients am I expecting to see? In terms of getting started and trying to decide what's the best device for your clinic, I think it's really good to go to company workshops where different lasers are demonstrated, go to conferences where you often will see a wide variety of lasers and talks on different lasers and the conditions that they treat. And also, I think one of the most valuable things is to actually speak to somebody who's already got that laser and get a sort of genuine review, if you like, from them on what it's good for, what it might not be so good for, and how useful it's been in their practice.